The headmaster of a primary school in Kanpur died on 28 November Tuesday night due to rabies after being bitten by a pet cat. A week before this, his young son had also died. Their pet cat was bitten by a mad dog 2 months ago. After a few days, she became violent and bit the headmaster along with his son and clawed his wife and daughter. Instead of getting anti-rabies vaccine, the family had only got tetanus injections. However, the headmaster's wife said the cause of death was heart attack. As per neighbors, along with the people of the house, told that their pet cat was bitten by a mad dog about 2 months ago. She was treated, but became infected with rabies and died. Along with biting headmaster and his son, the pet cat also clawed headmaster's wife and daughter. The family had just got a tetanus injection. Got the vaccine after 2 months after son's death. The family reached the district hospital on 24th November and got anti-rabies vaccine. The vaccine, which should have been administered within 24 to 48 hours, took 2 months to get administered. According to the sources, before his health deteriorated, headmaster had become afraid of water. What is rabies? Is a deadly virus spread to people from the saliva of infected animals, particularly stray dogs. The rabies virus is usually transmitted through a bite. Once a person begins showing signs and symptoms of rabies, the disease nearly always causes death. For this reason, anyone who may have a risk of contracting rabies should receive rabies vaccinations for protection. According to experts, rabies infection is dangerous. There is a danger if the vaccine is not administered within 24 to 48 hours after the bite of an infected animal. Symptoms of this virus appear after many months and even years, and the infected person loses his life. Symptoms and causes. Usually there are no symptoms of rabies for several weeks after it enters in the body. After some weeks, 2 to 12, rabies virus attacks CNS, central nervous system, prodromal phase. Patient may experience flu-like symptoms. In the final stages, it attacks brain and spinal cord, and it grows rapidly. The patient may become paralyzed, go into coma, and ultimately death. Later signs and symptoms: prodromal fever, fatigue, headache, cough, sore throat, muscle pain, nausea and vomiting, diarrhea, pricking or burning sensation, paresthesia at the wound, excessive salivation, hallucinations, partial paralysis, insomnia, fear of water drinking, hydrophobia, fear of air being blown on the face, aerophobia. Why there is no cure for rabies? There's no cure for rabies once it's moved into brain, because it's protected by blood-brain barrier, which is a layer between brain and the blood vessels in head. Its job is to protect brain by keeping toxins and other dangerous substances from getting into brain from blood. It's like a very fine strainer. Researchers aren't sure how, but rabies locks this barrier down even further, so medications that might destroy it can't get through.